non-union, pus was pouring from this side and there is a gap on one side only. So we thoroughly debrided, put an antibiotic rod and beads here, and once the infection was under control. By under control I mean the pus stops coming, but you can still get, after pressure you get some spinous formation and you may get a bead of pus. In that, even then you can continue to use this, and then once you are sure that there is a very small infection, then go ahead with replace it with an interlocking nail and bone grafting. We used here a strut graft from the iliac crest. In the type 2, where there is infection is severe but the fragments are aligned, there is no gap, no deformity. In that case, in the first stage, again you debride, insert the antibiotic rod and close the wound. At second stage, the 6 to 8 weeks, remove the antibiotic rod, repeat debridement, interlocking intramedullary nail, bone graft if necessary, and put beads and close the skin. This is type 2 example. This patient had this type of severe infection, very severe AR, and note we put an antibiotic rod and filled up with antibiotic beads and stabilized with ilizarov apparatus in addition to the antibiotic rod. And then once the infection was under control, we changed the antibiotic rod to interlocking nails. Still there was some non-union, but ultimately it healed, though the sinus was there for a long time. This is the final picture. This is the example, and note how the severe infection was there. This was the all infection which are completely healed up with this treatment. Another example of this patient had this gap here and infected non-union. Again, same treatment was given and united. In type 3, in which the infection is very severe, there is an infected gap more than 4 centimeters, maybe 10 centimeters. There may be shortening, there may be deformity, or there may be a combination of all these 3 things. The treatment is by ilizarov principles. In the type 3 again, debrima, correct the deformity, treat the gap by beads, fill the gap with beads, bone transport, distraction and compression, and bone grafting at the end. An example of this was the patient who had this is the first slide. This was the patient who had a severe infection, and this was all taken out and created a gap which was treated with a corticotomy here. You can notice the corticotomy here, and this was the acute docking, and then bone grafting was done, and then this is the bone transport. You can see the bone transport here and the final union. Bone transport has revolutionized the treatment of gap non-union. There is another example. This is a severe infection. This was treated with this, and then finally we got this away. But his bones were so bad here, so we decided to treat the lengthen the tibia, and tibia was lengthened. The only problem is the knee appears at a higher level, but it's a cosmetic problem and not a functional problem. Same patient. So take home message is a thorough debrima, number 1. Number 2, antibiotic beads and rod convert the infected non-union into aseptic non-union, and stabilization. Stabilization and stabilization is the most important factor. You stabilize it initially by an antibiotic rod and ilizarov apparatus, and then once the infection is under control, change over to interlocking intramedullary nail and start functioning right, weight bearing right from day 1. Thank you very much.
Yeah, any one question please? Yes, yeah, Dr. Bari, please speak on in the mic.
This classification is made by you, type 1, type 2, type 3. There is a Rosell AO classification, you know.
Rosenberg. Rosen's classification.
Can you pass your comment regarding the type 1 to 3 can be treated only by ilizarov? Type 1,
all three,
type 2 and type 3.
All three require ilizarov, all three types. In type 1 only it is that if you put ilizarov and antibiotic rod, it heals up. In type 2, you have to put ilizarov and antibiotic rod first and then change over to antibiotic rod. And then third requires bone transport and deformity correction. Thank you.
Yes, doctor, yes.
Sir, instead of K-nail, have you used any IM nail and put a antibiotic
See,
cement over?
the Thongse from UK has tried using a routine nail and coated it with antibiotic and then made a nice block of this and used it. But the debonding, that means when you are hitting, the cement broke. While taking out, the cement broke inside, and it is hell of a problem to take out that cement. So the chlor leaf, it's a very good question you have asked. The chlor leaf has got outside there is a, so the outside there is a fixation, and the chlor leaf is one side it is open, so the cement goes inside, and the cement and the chlor leaf gets a nice bonding. So in our more than 600 cases, there are not a single case of debonding. Only one case was, the problem was the taking out the nail after 1 year. But in most of the cases, the nails comes out even after 1 year. That is because only recently I came to know about it, that the mesculates membrane. Have you heard about mesculates membrane? Yeah, mesculates membrane is one, when you put a cement spacer, a membrane is formed around it, and you take out the cement block after 6 weeks and put bone graft. This membrane is osteogenic. It has a metabolically potential. So similarly, the similar thing must be happening when you are putting an antibiotic rod and taking it out. A membrane is formed around the antibiotic rod, and then when you put bone graft takes very well. So that is the principle. So you use chlor leaf nail and don't use any other nail.
One thing more, like you're putting the cement and rolling it with the hands, so there's no problem in the...
No problem. You roll it very, very nice, uniformly, and you pass it through the nail measure, so that you will get 9 millimeter or 10 millimeter, whatever it is. If there is a single bump like this, at that bump, the diameter of the nail is 13 millimeters. And then when you hit it, a fracture occurs. I got many phone calls, sir, I did according to your, as you told, but then I had a fracture. I told him, did you put in the nail measure? No.
Sir, one comment, I have seen some surgeons like using a silicone tube and filling the cement with
silicone
the
tube,
bone gun and then passing
that was first, very interesting. Dr. Pale was the first person to do that. And then he put a nail and then silicone tube, cut the thoracic tube, cut the tube and this. And then when he came to us, and we showed him that clover leaf is very good. Oh, that's good. And then he started using the clover leaf.
So can we use a silicone? What do you recommend?
No, don't use. It is very cumbersome, very difficult, and you have to put a wire inside, and that wire is not uniformly attached, and that it may break. So many problems.
No, can we use a silicone tube and put a K-nail, thin K-nail under it
No, not necessary. It is difficult. It is very easy to do it. Do it once and you will see.
Thank you, sir.
Yeah, so this is some philosophical question. I accept that this is one of the way of treating infected non-union.
Yeah.
I personally treated a lot of infected non-union all over Maharashtra, and I principally followed only ilizarov principles. By doing corticotomy, antibiotic beats effect is there till the distraction is going on. My question is whether the infection is the cause of non-union or stability is the cause of non-union.
Both.
Yeah,
both.
But sequestrated bone is cause the discharge, not the infection. So if we can do thorough debridement, put ilizarov, do corticotomy, and do lengthening, antibiotic bead effect will be done by corticotomy, stability will be given by ilizarov, and can be done in one surgery.
Absolutely.
Putting rod, removing, it's all a lot of surgeries.
No, it doesn't take much time. I feel we have done both, without using and with using, and compared the results. It is very easy to put this because stability is extremely good and you don't have to do ilizarov for a long time. You keep only for 6 to 8 weeks or 10 weeks and then remove it and interlock it. It gives excellent results. That's the only thing. It cuts short the period and it cuts short the external fixator wires and other things. You don't have to do all those things. Corticotomy is also not necessary in these cases.
Sir, but
Corticotomy is only necessary when there is a gap.
yeah, but see, the important principle of ilizarov is
Principle
corticotomy.
is, yeah, I agree with you. Principle is the control of infection and stability.
Yeah, but the control of infection principle of ilizarov by corticotomy is most important, which is we lost, in that plan of management. If we use corticotomy, I think antibiotic beads might not be required.
Suhas, it is not necessary to do corticotomy in all cases. It is only necessary in only when there is a deformity, when there is a gap. Why do you want to do corticotomy? For simple things, when there is a no gap and no thing. So, that's
Yeah, difference of opinion. Thanks.
Dr. Swasha, you do the corticotomy in one stage of the fixation and everything. I differ from that.
Sir.
I do debridement and fixation first, let the infection settle down, and then I do a corticotomy, because when you do, there is pus pouring and that pus can get infected the corticotomy. Yeah. I got 2 cases like that. That's why I stopped that and I do the different thing.
Sir, I am agree with you also, Junjunan also, but I am more agree with Shuhasha.
Okay.
That's why my question was
No
like
problem,
that.
no
to
problem.
eliminate, the Ilizarov says, to eliminate infection, vascularization of the osteomyelitic center is increased by the biological stimulation of cortical lobby. This is the theory of Ilizarov.
Yes.
Yes, we found and we had some research in our institute about the specific function of ilizarov and osteotomy and creating a special antibacterial features of liquid around wires of destruction process, which has a very great effect, like antibiotic effect, but more long. And we discussed this with our colleagues and yesterday with Dmitry Yurich. And it's like if you're using antibiotics, it's like maybe beating, yes, their microbe. But if you are using ilizarov and destruction osteogenesis, you're getting the tissue more strong. So it works like this because you have good vascularization, a lot of blood supply. So I think that it's important this position and this position. So we must make some complex decision in the end. So this is important and another is important. The main problem in osteomyelitis that you can't reach with antibiotics or with a good supply the sclerotic bone, because in osteomyelitis the main problem that it's chronic and it's impossible to break this wall to get antibiotic or something else. So anyway, we make very big resections in the osteomyelitis process. We try to eliminate all bad tissue, all sclerotic tissue, everything, very big gaps, creating very big gaps. And after this, we're making, in one stage usually, we're making osteotomy, have good supply, as we're an experts in making good destructive callus, so it's not a problem. But anyway, if you're using antibiotics or if you're using other antiseptics, it's impossible to eliminate infection because it's impossible to get it in the center of infection. Yes, it's to break these walls. So it's better to resect absolutely to get away all bad tissue and then to make a new destructive callus. The only one choice for 100% success. But you can do this only with the ilizarov technique.
There are different ways to skin a cat. So this is one of the ways, and this is another way. Yes, Milind.
Okay, now we will have a video how to put a ilizarov frame on tibia, and then we all will do in batches. There are how many centers are there? Four centers are there, so you can divide the people and try to do it, and the other senior people will watch and they can solve some difficulty if at all is there.
Yeah,
Okay.
we are initially going to do the tibia frame. We will show the instrument name and the video will running with that. So our senior doctors, Dr. Junjanwala, Dr. Harshad Shah, Dr. Manish, Dr. Gubin and team, Dr. Bari, Dr. Subhash Shah, Dr. Milind Chaudhary, Dr. G.S. Kulkarni. They all will teach you at the various frames there. Yeah. Okay. So I'm just telling what are the ilizarov equipments. Until now all the preparations are being going on. We will start the tibia frame and after that femur frame. अभी सर इंस्ट्रूमेंट्स के बारे में बताते हैं. Introduction. The hardware apparatus of the ilizarov can be divided into two primary and secondary components. Without proper knowledge of these components, it is impossible to attain the build an ilizarov frame. The primary components are standard parts that join the skeletal to finished frame, just like the wire rings and wire fixation bolts. And secondary components are the special elements used to construct the frame of the apparatus, such as threaded and telescopic rods, connecting plates, hinges, posts, nuts and bolts. These you will get in the workshop. The various wrenches are also considered secondary component of the apparatus. Introduction. Apart from this, one should also have the equipments needed for standard osteosynthesis of bone, including osteotomes, power drills, mallet and pliers. Two basics as a form for different anatomical requirements. Wires. The wires serve to connect bones or bone fragments to support elements of the frame. They differ in diameter, length, shape of the point and nature of the bead. The choice of the wire determined by the bone density, the fixation rigidity needed, the size of the limb and the goal of the treatment. Following wires are used: bayonet point and trocar point and olive wire. We will show you where what we use there. The bayonet point used mainly for the diaphysis of the long bones, as it has greater penetrating power. The advantage of this is, you can see here, it is the bayonet point is here. Anyhow, the advantage of bayonet point is that it causes less heating effect of the bones and soft tissues. It produces hole of a diameter slightly larger than the wire, thus causing less friction. The trocar point is used in the metaphyseal regions of the bone. There are two regions, metaphyseal and diphyseal. In diphyseal we use the bayonet point, and in the metaphyseal we are using because it has less penetrating power, it produces the hole of exactly the same diameter, and bayonet points more diameter. The advantage of trocar point is that it has greater hold in the bones. Now olive wire is the main important things are there. This is the olive wire there. So the olive wire is used to achieve and maintain the position of the principal fragment after fracture. It is also used to hold the fragment during correction of the deformities. Now this is a frame construction. You can see how the wires are being used. Rings come in different sizes within the internal diameter, ranging from, we call the internal diameter, 80 mm to 240 mm. Smooth holes are situated around a half ring. Its ends are bent and into ledges. This allows attachment of the one half ring to another in the same plane. Half rings can be used alone. The rings are made up of either stainless steel or carbon composite. Half rings are lodged at the ends to accommodate the other half right so that the assembling ring is in the same plane. These are available 12 sizes. Hole diameter of it is 8 millimeter. Mind you, the threaded rod has a 6 millimeter diameter. So at a little play we can do that. And with clear spacing between the holes of the 4 mm. Half ring, you can see these are the half rings and these are the laces there. Here it is the laces there. Now the main important thing is that both the half rings should be in the same plane. Both the half rings should be in the same plane. Now there is a fifth eighth ring. It is used near joints, wherever the knee joints, shoulder joints, to facilitate movement and dressing of the open wounds. It is also used in combination with another pudding for reinforcement. There is a half ring with curved ends, that is called the 5/8 rings, or with the outward curvature at the ends. The configuration matches the deltoid area of the shoulder and exclusively used in the shoulders. There are carbon foot rings are used. It is especially used in hind foot, forefoot to give better space for wires. These are available in the sizes 80, 100, 120, 140 and 160. This is how you construct that frame there. You put the frame here, you connect over here. You know, this is the how we first of all we make the frame that will you make over here and then you apply over there. This is the application of the U-shaped ring. It is usually used into the foot. Advantage of the carbon ring. Primarily their archage is actually a thick half ring along at ends. The holes in the arch are staggered to permit 2 rows of fixation points. Arches are commonly used to secure wire placed through the proximal femur. There are many types of arches: Russian arch, Italian arch and Canberra composite Italian arch. These are the Russian arch commonly used for upper third of the thigh. The staggered holes facilitate better positioning of the wires. They are available between 80 to 260 millimeter diameter. These are Italian femoral arch. It comes into the 90 and 120 degree. This is femoral arch are provided slots and holes to secure flange screw. Half rings are used in upper third of the thigh. These are available 90 to 120 degree. There are certain carbon composite rings are also used. This how here we have applied the Italian arch over the upper part of the thigh. There are bolts. These are many types of bolts. These are used to secure the wires and can be either cannulated or slotted. These are the wire fixation bolt, wire fixation cannulated bolt, wire fixation bolt with threaded socket. Wire fixation bolt, these are 6 millimeter diameter, 18 millimeter in the length, and bolts head thickness of the 6 mm. The bolt heads are either hexagonal or with 2 flats and rounded surfaces. Slotted bolts have an oblique groove on the under surface of the head. These are used for the fixation of the wires here. Wire fixation, if the wire comes into the hole in the center, so we have the cannulated box at 2 millimeter hole is there. Bolt head being double in thickness, it facilitates turning when the adjacent holes are occupied by others. Cannulated bolts are perfect for 1.5 millimeter wires. This is the wire fixation with the socket. Threaded rods are used to interact rings. These are 6 millimeter diameter. They are available from 40 to 400 millimeter. Slotted cannulated rods are sometimes used. The groove is there here at the one end, which wire can be secured with the 2 necks to provide traction. Partial threaded rods, the central portion of the rod is not threaded to prevent damage by locking nuts when used in telescopic rods. These are available in the sizes of 130, 170 and 210. Telescopic rod is a threaded stud at the one end here, and a perpendicular locking bolt at the other end to hold the threaded rod. It is hollow tube with its inner diameter larger than the outer diameter. It is used to increase frame rigidity when connecting rings. These are available in 100, 150, 200, 250, 350 and 4 millimeter lengths. You see where now you are having this. Here you cannot use anything except the telescopic rods when you are correcting a big correction here. There is graduated telescopic rod. These are available in the sizes of 600, 600, 150 and 250. Application of the graduated telescope, when you do the lengthening here, these rods are used. There are connective plates of the various sizes. These are 5 mm thick and 40 mm wide. These are short connective plates, and this is the long connective plates. Connective plate with threaded ends. The twisted plate used to connect long connecting plates to the frame. These plates are used to connect between the holes of vertical and horizontal planes. There is a curved plates are used extension to the half ring. You can see that here you can use a lot of connecting plates are there. We were sometimes correcting this deformity. Hinges are the main thing. Spliced posts with a single hole, offset to interfere each other with a bolt. These have a supporting base, two plate surfaces for matching stud. They are made with either male or female. There are many types of hinges. They are hinge female standard, low profile, hinge male, low profile, hinge 90 degree. These are the hinge female standard, low profile. Male component for the hinge is there, hinge male standard and low profile. This is the standard, this is low profile. This is a 90 degree standard low profile hinge. Here how we can, someone was telling of the hinges. So these are the very important things there. Now how the application of hinges, it was taught today to you. So these are the places where you use the, these are the places where we use the twisted plate is there. Post has a 2 to 4 mm hole size. Use an auxiliary support. They are male and female. These are the male and female post. Application of the post are there. Sometimes we are using this. This is applied the female hole, female and other things. Nut and bolts. Nuts are available in thickness of 3, 5, 6 mm. 3 mm nuts are used as a locking nuts. 5 mm nuts are used as stabilizing all forms of frame. 6 mm nuts are used to connecting rods. There is a nylon insert line is used to hinge to perform control motion, and there is quadrilateral square head nut is 100 mm long and have a coordinate head. The head is marked numerically from 1 to 4. Connecting bolts are there. Size is 4, 10, 16, 20 and 30. Their bushings are two sizes, 12 mm cylinder and 7 mm diameter. It is 1 mm wider than the threaded rods. This is a thread sockets of a hexagonal external shape with a 10 mm open or socket range for socket range. Washers are there, many washers, spacing washer, slotted washer, conical washer, split locking washer. We will tell you in the workshop. These are the various type of spacing washer, conical washer, slotted washer, flat sided, split locking. These are blocks for the half pins. These are the blocks for half pin for center sleeve. Center sleeve for block for half pin. These are oblique plates. These are very important in the proximal part of the thigh. We connect the arch with the rings. You can see that here. This is the ring is here. This is oblique support is there. This is a box wrench for the connecting the bolt. Socket wrench for wire fixation bolt is here. Wrench are 10 to 11 size. Wire tensioner. This is a mechanical or wire tensioner direct measuring. Application of the wire tensioner we will tell you in the workshop. There is the osteotome. Various type of osteotomes are there. This is a corticotome. Thanks. Now we are going to start the workshop. We will run the movie and you will see that.
System. The system on us is so easy. Do like this. So take a ball and connect only from one side. Okay? Only from one side.
Ball should be tightened with nut and bolt. First on the larger side, then remove this one. proximal wire tension, determine the wire tension. Wire is fully tightened. Distal wire is also tension. With the help of wire tension. Wire is fully tightened.
So now these are too short. They're using for hinges to block hinges. So do like this.
The direction should be posterolateral to anteromedial.
Look, they must be in this position, not in this, but in this.
Half in block.
So in the end it will be like this, but lock them only from one side. So this
3.2 millimeters.
for all four, to make it quick. Because if it is okay, it's not more than 40 minutes, 1 hour to make a fraction. So do this.
Half in block. In this block is tied with nuts and bolts. After the stand screws will be fully
We
tightened.
don't know, we don't have fibula, unfortunately. It will be better to show how to work with fibula.
3.2 millimeter degree on the skin of the tibia and a 5 millimeter sand screw is the half in block. As the half in block is the anterior part of the
west and go for like
a
that.
little bit of
Very
3.2 millimeter
You can put ilizarov in tibia in any diseases.
5 millimeter sand screw is the tilt.
Fracture. You can start
With this half pin block, now another half pin block is on the distal in the anterior side. Medial to the tendon of tibialis anterior.
Yeah, ready? No, only from one side.
The half pin block.
Guys, only from one side. It's very important. Don't try to put them all. From one side. Only one. Only one. So I want to go to the way. Yeah, it's okay. So this one is very sharp.
And the 3
So pay attention. Usually we have
and 3.2 millimeter diameter.
we have an accumulator. An accumulator drill. We can use this one. So usually we have a special system for fixating wire, not like here.
Try to follow the
Then you must have dress. Don't touch this with the gloves, because it's usually gloves will be on your wire. Yes. So, yeah, you need a little piece of cotton. Yeah? So it will be like cotton. Okay.
it will not be wait for. So this is mechanical and biological.
It will be like cotton.
Is only mechanical and
So at first you must roll on the tibia from the knee down. Remember, from the knee down. So at first only one wire, and then you begin to build like a building. From the base, there and there and there. Fracture is in the middle, for example. Yeah? So at first you must tie the bone, and now this is lateral, yeah? This is middle, yeah? Do you understand? So here is fibula, and touch the caput of fibula. Avoid it. So it's better to go from this side to feel fibula's head, because if you will touch fibula, you can damage and it will be very bad complication. Okay? So if you are starting to stand from this side, let's use that. But now I can do it. So at first, make the first wire. Get the first wire. Это моя. It's mine. Yeah, because it's very important. So
how much away from the joint line?
Feel the bones. Yes, it's like feel the caput of fibula and be about 1 centimeter around the fibula. Yes, to avoid fibula. Okay, and do like this. Don't touch with the gloves. It's very important. Okay. then you will feel that you're getting very quickly, easy. So stop, don't do anything. Deblock this, take the hammer, yeah, and beat it.
What's the big drill in Libya? Hey, you have two drills. You have two drills. Or what?
It's not accumulator drill. If I don't know if we can use it. Yeah, but it's usually easy in metathesis. Yeah, thank you. And it's very important rule when you do this to protect your helper, your assistant. Cut the sharp end, because in 1 minute somebody will push his hand anyway, so it's important. We will have a cutter, so do this to make it safe. Yeah? Okay, so be attentive not to cut your head. Then you're helping me, yeah? Wonderful. Then you do like this, only one wire. So I do it like this, and then put it in this position. You see, as usual, I do like crossing, but it's my trick. So you can do different, but you can do like this. It's really can be different, but I usually do like this. Yeah, one from one side, one from another. It's my little trick, okay? And usually I put in this way that the connection is here and connection is here. It's very important because you have more holes than connection. So it's a little another little trick. Practical trick, okay? So please help me connect. So only one wire now and only one ring. Nothing else. Yeah, a little bit as usually. You have some deformity. Of course, you will make another position to avoid dislocation. So then we will take fixators. Yeah, this one. So be very attentive. Yeah, put the fixators in this position. Yeah, connect. Get them out. Pay attention with the sharp end. Okay. So it's better to cut it. Okay. Great. And another one. Yeah. So yes, on this side. So the rule that you can't deform wires. It depends on scheme. As usually here is more so that you will get more gap here. Not now, but now not now. I will show you one more. Okay, you can cut only sharp, but not so close. Sure. I'll leave it side. No, I mean it's. Yeah. It's okay? No problem. No trauma. Yes, then you take ordinary. Yeah. This is. Stress, yeah, okay. When you're stressing, it's very important not to change the position, so it must not to rotate the head. It's very important, okay? Do this. Okay, do this here. I will help you from the another side. So here, stop. It's a problem with threading. So, yeah.
Long block. Keep the long block. Ring must be
now it's standing, it's quite easy, but stress here that you can turn on as much as you can here, but don't rotate the head. And then, no. You can use this one for my specialty. Or you can use this. I don't like this because it's usually has some blocking problems. So use this or use maneuver with rotating of the balls. And then do this. Oh, okay. So to be sure that this ball, this fixator is good, you must have a clamp. Do you have a clamp? No? No clamp. So if you have a clamp, usually put the clamp here. When you will tighten the wire, you will see if you not tighten it good, it will go. So you can put a mark, but we usually get mosquito and put it here. So when you are tiring, you can see how it is going. It's bad, but you didn't tie it well. And you can use this maneuver, this trick, when you make reposition. You can put the clamp, and then when making reposition with the stopper, you can see how the bone and the clamp is going. So it's very easy. It's a very easy maneuver. It's not like dynamic. I don't like this. Sorry. I have one. When I had also practice, and I tried to restore it. It is not first to bend it. I don't like it's too heavy to. Should you bend it like this? No. Yeah. It's in the end. Yeah, I do this. Not to hurt somebody. Yeah. So when you want to make as you can, then someone must do it with two hands. Yes, two hands. And this must be tightened. Okay, this must be tightened. This type of maneuver can be done only in eccentric, not centric. It's no problem. No problem. In centric also? No problem. Absolutely. With your two hands, no. Do one man. You must feel like this. And then you're doing like this.
Not like this.
Not very good metal, yeah. Really, I don't. No, it's another size. You need Russian devices, so really I'm more. You really, it's not very good. It's a problem. So you do like this. So this now this one is. This should go up and this should go down. Yeah. Stop. Oh, see. So you're going like this, and it's okay. Yeah. You can do like this. So.
You have done this for snatching.
Yeah. Even rotation it will be tightened. So then stop. Look. Take me another one. Give me another one. Another one. This can be done post-maternity. Wires are short, you can apply tensioner. No. You must. These wires are basic wires. They must be in the base. You must do this and tighten them very well. This base. It's fundamental. You must tighten them very well. I mean, basically you should use this. Of course. This is an alternative. Yeah. Usually used in orthopedics. Then you do like this, but so I don't want to use my hammer, but I show you, yes, that in practice you should. No, don't touch it. Don't touch it, it's okay. Oh, you can do like this. Yeah, I enjoy this. Really. But you can do one side. I enjoy it. I don't know why. I enjoy it.
This is more stable.
Maybe, but no biomechanical investigations in this.
Well, this is not better, doesn't matter.
Thank you guys. Okay, now. And we will do this with this, okay? To make different.
Cut it short. So you need all
So others will prepare and help us to make. They will take rods. So prepare rods like this. Prepare rods. Take 3 rods and prepare them.
This is main road.
Use this one.
Main road. If we don't do this, we are going the same direction. Just go in this direction. That is Russian technique. Very good.
That's okay.
It doesn't work.
It goes upside down. Yes, you will see if you are typing. It will not. Anyway, no problem.
Now you are
Yeah. Now it's okay. Now it's okay. You can do it. But you must be sure that this code is okay. So exact hardware is maybe. Then you must do like this. You mean that you can get yeah, but it depends on the quality of where is another? This one is locked, no problem. So do like this, yeah? I like this. The base is ready. Attention, the base is ready. Then you prepare these things here. Okay, now we can stop. Another. Also, like this. Lock. Don't be in a hurry. So then you count here, do like this. Yeah? You can put here and you can put, you count 1, 1, 1, first, second, yeah? So tighten 1 and it will get in the right position. Okay? Tighten 1. 1. 3. Prepare more. Here is a fracture, yeah? Prepare more. Prepare more. So take more. Like this. Get here one more, something. 3 is enough.
Two wires for one ring is enough, or you want more?
Yes, if it is an ordinary fracture, 2, 1, 6 is enough.
Yeah, so the 2 wires and 1 shell scale, or 2 shell scale, 1 wire.
Count. 1, 2, 3. 1, 2, 3, 4. Mistake. Your location.
That is still the step. How much it cost? 8,000. पूरी assembly 7,000
Right. So put another.
Normal Indian stainless steel
हमेशा कीजिएगा तो 4,000 हो जाएगा इसका रखने
रिवीलिंग काम आ जाती है वायर्स नहीं होता
रिंग से तो महंगे रहते हैं वायर्स तो सर
आ जाती है
There is more
बोल्ट्स काम नहीं आते स्लिप कर जाते हैं
नट तो वैसे 200 में सॉल्व होती है 2000 और
So you do like this, same pose. Very good.
and one more. 3 volts is okay. Sometimes 4 if it's a heavy person. Yeah, fracture is usually somewhere, yeah. Maybe here. Oh no, I will show you. Oh, fracture, yes. Fracture is here, yeah. Yeah, I will show you. So now you're building from this step by step. You're building this structure to the end. So it's very comfortable when you're doing only like this, because in another way it will be a problem. Build step by step. Yeah. Then it's usually a little bit going like this, because anyway there is some. Yes, but anyway it's not a problem. Then take more long rows. Yeah, it's too short because structure is here. Look at the pen, something. Pen. So fracture is going like this. There is fracture. More long rods. Look at more long rods. Yeah.
How can you do this? Finish, go,
Prepare please.
and this way.
Prepare you.
This is the technique for bending the words.
So the main idea that it must get to mother levels, so be like here, yes. It's okay. This position. Yeah. Last thing. 1, 2, 3, 4. Is that too short? So if you have a short and you don't have enough, what you can do, I will show you. Let's try to see what's going to do. Okay, I will show you if you have a problem. So prepare you can use this enough. If you want a very long, you don't get telescopic.
Sir, the ideal is 2 rings above and 2 rings below the fracture. That's the minimum?
Even if it is too close to proximal, so you can use this. It hinges like this.
My question is, like, suppose the fracture is somewhere here.
So if it is here, you will do the same, but the base will be here, the base will be here. That is the positioning. I will show you.
Only one wing will be there about the fracture.
Only one.
So more wires for the stability.
Absolutely. So I will show you. Then you can.
So don't we always use
I'll show you. Always in construction osteogenesis when you're doing orthopedics.
In the second option is always olive oil.
When you're doing orthopedics. When you're doing orthopedics.
Overall bend force very in valid section, no need of there is no need of olive oil.
No. When make it position. When make it position, we usually use a lift.
In any position, but if it is a straight or we want only this section, then
We use a lift in the base to make it more stable.
another one, give another one to
No problem. Block it. Then put another.
Here and here you can extract an area. What if you want to extract here, there will be wires, additional wires only here. Only if you're extracting this must be one. But usually if you're extracting it must be stable. It must be stable. It must be stable anyway. It must be stable. Okay.